We are learning that New York had undetected outbreaks of COVID-19 long before testing showed a major problem. CBS 2's Jennifer McLogan reports now on the silent chain of transmission.
Patient 750 recovered and discharged from NYU Winthrop, the hospital with the dubious distinction of having the first confirmed COVID-19 case on Long Island. But now startling new discoveries of the virus outbreak and its spread are rewriting the timeline across the country. New York City may have already had 10,000 infected carriers of corona prior to its first confirmed case March 1st.
We were beginning to hear about these cases in December and January.
Dr. Adam Singer, professor of emergency medicine and research scientist at Stony Brook, and his partners published their findings in the New England Journal of Medicine. They believe they saw their first patient a full month earlier than NYU Winthrop.
When we saw our first case, which I say was February 7th, the definitions at that time was that the patient had a fever and respiratory symptoms and came from an area like Wuhan.
Initially, the first corona-related death in the U.S. was reported February 26th in a suburb of Seattle, Washington. But this week, Santa Clara, California signaled the virus may have spread and been fatal in the Bay Area the first week of February. Was the virus spreading undetected on both coasts?
The awareness, the recommendations, the testing, all of that kept changing and evolving.
Do you wish that you had been able to test back in February 7th?
We did not have any testing back in February 7th. Only the CDC was testing.
The fact that there were sick people on the East Coast and deaths on the West Coast in early February is very significant. Had there been testing, information could have been shared and tracked.
The virus has been here and was here in our community, in our country, long before we were doing testing.
Researchers were left largely blind to the specific locations and mutations.
We had community transmission, probably to a significant degree, far earlier than we had known.
Some believe if there was earlier proof the virus had found a foothold in America, the public health response would have been more urgent and lives could have been saved. On Long Island, Jennifer McLogan, CBS 2 News.